Welcome to Word of Mouth. We're here to take you on a journey as we explore a scenario that most Canadians are very familiar with, a visit to your dental office. Have you seen your dentist in the last year? Chances are that you have, and this program may help you understand the experience. Check the mic, check the mic.
For the ability for me to do this for people. I mean, it's an honor. I feel being a dentist, it's an honor for me to do that for all the people that I can see.
Intact for the rest of our lives, and that will make us look younger, be healthier, and
make a contribution to someone's smile and overall enhance their self-esteem and self-confidence.
First and foremost, have an obligation to the patient to provide them with the best technology, the
practice,
the best
and I would
materials
much
that we can offer.
Go see a profitable dentist than one that was running on the edge or not making a profit, because I know the profitable one is going to give me
top of your game in Toronto,
best
especially
treatment,
because people know their dentistry here, and we're used to good things.
What dentists need to do is to listen.
Of their business with their primary goal, which is to take care of the people attached to the teeth.
Life is challenging for all of us, and there's so many things that we can't control, especially in the area of our health.
So the final question remains, what's in store for the future? Canadian dentists will continue to be at the forefront of innovation, and Canadian patients can expect the best quality of care in the world. There are about 20,000 dentists practicing in Canada, serving about 34 million Canadians. These dentists employ over 100,000 Canadians and expend over $4 billion per year in payroll costs to the hard-working members of their team. Dentists strive to deliver the best quality of care, and they employ the highest and best technology available. And the standard of care in Canada is amongst the highest in the world. We interviewed a number of Canadian dentists, and we asked them, what is your motivation? What is your passion? And why did you become a dentist?
well, I've always, as many young people growing up, we try to find our place where we fit into society. We try to find something that might interest us and where we feel valuable. And dentistry was the place for me. And it was a place for me ever since I was 10 years old, because I lived in a northern community in northern Ontario, and we didn't have a dentist there all the time. But boy, did the people pay attention when the dentist came to town, because they were in dire straits, and the lineups would be there. And in fact, my first contact with a dentist was a wonderful man who came in on the Canadian National Railway line in a coach, and he would come up to our school and he would check us all out in school with a tongue depressor and a flashlight, and then we would all get appointments and we would go to the dental chair during the day. They would take us out of school to do this. And by 5 o'clock it was very dark in Hornepayne. And then the townspeople had their chance to get there. There was no waiting room in the dental coach, so they would line up 15 deep waiting to have the dentist have a look at them after hours. And so I knew the dentist was a very important member of our community. And I know that it would have been nice if he could have been there a little bit more often, but in those days the dentists weren't available. We are so darn lucky today to have as many fine, well-trained dentists available to us. And we don't have to suffer all the problems and disruption of our lives and pain that the last generation did. And so I wanted to be a member of that team, and I wanted to help that situation out.
I like the aspect of dentistry that, I can make a contribution to someone's smile and, overall enhance their self-esteem and self-confidence. Let me ask you a question. Have you ever been in a gathering where somebody's cracking a joke and, right at the punchline, When everyone's laughing, someone covers their mouth with their hand. To cover their smile. Why? Because they're embarrassed. They're embarrassed to show their smile. This is where I wanted to get in there, and I wanted to be in that position to improve one's overall, confidence and make them smile all the time. All in all, that makes a better person in the end. So that's why I decided, to make my contribution to society by becoming a dentist.
I became a dentist because I realized early on that life is short and precious, and I wanted to have the opportunity to make a difference. Make my life actually count in this world. And I thought the best way to do that was to be able to impact on many people's lives in a positive, helpful, productive way. And at the same time, maintain my excitement, my enthusiasm, and constantly be stimulated by that particular profession. I like building a little community around me, my staff. My staff are exceptionally important to my office, to my happiness and well-being, and there's a lot of dynamic going on. So there's a business aspect, there's a social aspect, there's the rewards of positive feedback. I'm meticulous, I like to do good work, my patients appreciate that, and I get that positive feedback. That's what keeps me going. That's why I wake up early every morning and I'm happy to go to work, because yes, I give a lot, but I get even more in return every day.
Well, dentistry to me is something I really, really enjoy doing. I've always wanted to be a dentist ever since I was 13. The way I see it, it's providing medical services, because it's partly a medical service. There's a lot of artistic work in it, and it's very creative and working with hands. And this is something I really enjoy doing. There's a part of it that's also the teaching aspect of it is very satisfying, because you're also working as a mentor for a lot of new people and new graduates. I have a few employees that actually want to be dentists, and they come and do some work for me here, and they're encouraged to do dentistry. They're inspired, and I like that. I like to see the result of that. We've had a lot of people who have come in and volunteered and watched, and now they're dentists. Some of them are specialists. So it's that aspect of it that also drives me and helps me take on big projects.
There is something driving, there's a driving force within me, and the driving force is to be there for the people. Share what you have. It's special, and you are obligated to share that. And I feel special that I can do that. I have people that actually, they look at themselves and they start crying. And the crying is from tears of happiness. I've taken somebody who had absolutely no teeth and gave them teeth. I tell people that the eyes are the windows of your soul. Your smile is your personality. So for me to be able to help somebody to give back their personality, it's incredible. They're smiling, they're joyful. It's like a new lease on life. It is daily, all the different experiences. I had a young girl whose teeth were they were formed improperly. At 14 years old, could you imagine a girl going to school and being joked about, and she hiding her smile, not smiling at all because she didn't want anybody to see what she looks like. We were able to bring her in and put some cosmetic bonding on her teeth and reshape them and make her teeth. I mean, it is incredible the feeling that she had when she looked at her teeth and she could smile. She could actually go out with her peers. I had a boy who never developed some permanent teeth. He had no permanent teeth. We had to put implants in and crowns and gave him teeth. And he had to wait until he was older to do that. I mean, all these are stories. I had an older lady whose teeth were worn down, I think the ravages of World War II. She came to me, she said, you know what, I don't have many years left, but I want to be able to smile. I've always smiled. I want people to see that I'm friendly. You know, when you're, everybody thinks that I look, unhappy or mad all the time. So to be able to give her some teeth that actually made her look, that she can smile and made her look friendly, I mean, every single one of these is so important to me. I mean, that's why I can go home at night and I feel so grateful for the ability for me to do this for people. I mean, it's an honor. I feel being a dentist, it's an honor for me to do that for all the people that I can see.
We asked these dentists how they would compare Canadian dentistry to that of the rest of the world. The reason is that many Canadian dentists treat patients that have emigrated to Canada from across the globe, and they have seen dentists from all standards of care.
Well, I'm fortunate enough to work in an area where I see patients of many ethnicities. A lot of the times they come for the first time to a dental office in Canada and they sort of talk about their experiences back home. And in examining their mouths, the quality of work offered in Canada far by supersedes the kind of work they've received back home. And a lot of the times we're having to redo a lot of the work that's been done back home. So I think the latest technologies, the latest innovations, we're fortunate enough to get first crack at a lot of them and offering them to our patients. And the value of dentistry in Canada, I think, makes that possible. People care about their mouths here. People care about getting a checkup at the age of 3 or 4 for their kids. Whereas the values, I think, aren't present in other countries. So if you don't value something, you won't invest in it, you won't take care of it. So I think overall, just a general framework of society here is that we put emphasis on our mouths at a very early age, and we continue to take that as we grow older.
Our education has been so good. We have so many dedicated teachers who have taught us to do the things we need to do. We've had evolution in our field with our technology to just do things better than ever. And it wasn't too long ago that dentists really felt hopeless, along with physicians as well, for people indeed even dreaming about keeping their teeth. Teeth were something young people had, not people who were middle-aged anymore, because they were expensive and they were going to be lost anyway. Nowadays, we can truly feel that we can keep our dentition, our mouth, our communication device intact for the rest of our lives. And that will make us look younger, be healthier, and I think it keeps us whole for a lot longer. So, I feel very proud to be a part of this dental team and what we've accomplished in such a short time over the last 50, 60 years.
When I was a child, they weren't necessarily so good, but now we've got a high quality of dental care. I just think that having it placed solely in the private sector doesn't work towards having good general overall health.
I guess in Canada and United States, or I guess we could call it first world countries, obviously the dental care is much better than in the developing worlds. And I guess people that immigrate to our country may need more dental care than the people that are born and brought up in Canada. But again, that being said, I think that it's a pretty high priority for us as Canadians, and I can say us as Americans, North Americans. It's probably a fairly important thing. I don't know as far as third world countries how much money they have for things like that.
You can't compare it. The kind of patients, the kind of dental work that we see is actually, you've never seen this type of dental work before. And it would never pass any kind of the standards that we would consider acceptable in modern day dentistry, even in 1982, but even now in 2012. Sometimes there's a lot of work that we have to change. Like there's a lot of work that goes that gets bad over time or that fails, and we need to take care of that.
Oh, we've got top-class dentists here. I'm originally from, I'm not from Canada, I'm an immigrant, but the dentists in other countries, they don't have the tools and they don't have the resources to perhaps implement the latest technology. But the dentists in Canada, I mean, this is a world-class city, a world-class country, so you have to really be on top of your game in Toronto, especially, because people know their dentistry here, and we're used to good things.
I had a client once tell me, Peter, I've never seen 28 pieces of enamel walk through my front door. They're attached to a person with feelings. And dental professionals across Canada understand that they're not just providing treatment for corrective procedures, they're also serving the human condition, people's feelings. Dentists have created systems within their practice that use tools and technology to really enhance the quality of the entire experience that patients are having. Things such as neck supports, TV glasses, so that you can watch television while you're having your care done, hot towels after the procedure. All of those things make dentistry and receiving your dental care much more comfortable. And as a profession, practices across Canada are moving in the direction of spa-type experiences.
Canadian dentistry is right at the top of the tree. You know, along with a few other developed countries, the United States, Switzerland, Germany, Canadian dentistry is right up there. There's no question in my mind that Canadians have access to some of the best dental health care in the world.
Is dentistry a business or is it a profession?
Dentistry is definitely a profession on one hand, and certainly to become a professional, I spent 12 years at university to learn my craft and countless hours thereafter to improve the areas I've been interested in. However, I'm also burdened with a lot of responsibility. I'm responsibility to hire and train the best staff so they can serve our patients better, because all the service to our patient doesn't just happen in a dental chair. It happens at the front desk, it happens in the hygiene department, it happens in the radiology department, it happens in the dental laboratory department, and all these departments require money in order to make them work. And if I want to offer cutting edge or new normal high standard dentistry to my patients, I really have to keep up with all of these things. And so everybody who really comes to the dental office really have to pay their share for that. And that's the way I kind of see how it's fair.
Of course, it's a profession. Every single staff member that works in a dental office is professionally trained, and we do so because that's what patients expect. With regards to a business aspect of it, of course, we have obligations. We first and foremost have an obligation to the patient to provide them with the best technology, the best materials that we can offer, and in order to do so, we need to make sure that it's available to them. And so, yes, it's a professionally run business.
Dentistry is definitely a profession, and I don't think it can be approached solely as a business. But that said, it very much is a business too. Dental office overheads are phenomenally high, and they have to be successful to survive.
Well, actually, it's both. It's a business on one hand and a profession on the other. It's a profession where we, serve our patients, help them get healthy. And on the other hand, to be able to do that, it has to be a business that allows us to have the help and the equipment that we need to be able to serve Canadians and provide them with a high level of dental care.
Dentistry is both business and profession. The professional side and the business side is a homogeneous mix with each other. And, as a dentist, you have to find that balance and that mesh between the business and the professional side of things. From an ethical point of view, we have to provide our patients ethically with the best standards of care. And we should never forget that. Basically, the business side comes into play in that, we have to run this establishment. Dentistry is the perfect union between top-notch professional service and business.
I would say it's both. I mean, it's a healthcare profession for sure. We go to school, we learn about all the different medical aspects of dentistry, we learn all about the clinical treatments, the materials. So it is a profession, and we're taking care of a human being. That's the profession part. But as a business, we need to stay there for a long time. You know, I don't want to open up my healthcare practice and fail. So there's a business of dentistry, which means that we have costs and expenses, and we have payroll and all those different things. But that's secondary. It's secondary to the healthcare profession, but it is a business at the same time. We need to make sure that we make money and we can pay our bills, and we can hire our staff and pay the salaries, and we can get the equipment, the new advances. I mean, when you're coming to if you're going to a dentist, you want to make sure that they have all the best materials. Actually, not the top materials, but the best materials so that they can take care of you in the best possible way.
Canadian dentists are caring and loving people, right? That are really trying to balance the working of their business with their primary goal, which is to take care of the people attached to the teeth. And sometimes this part of it can be challenging for people, because I find most dentists, what they just want to do is they want to serve people in the best possible way so that they can walk out enjoying their quality of life and reaping the benefits of good oral health, which contributes to total health.
One of the most pressing questions in this program of the Dentists of Canada was this: can you practice ethically and also be profitable? All the dentists we interviewed agreed on one thing unanimously: their standard of ethics would never be compromised by their profit motives.
Ethics is a cornerstone of the dental profession. From the time the dental professionals graduate, they take an oath for the ethics and jurisprudence. Every year, it's mandatory for them to revisit the ethics and jurisprudence modules. And that is to ensure that they're providing the patients with the utmost quality and ethical treatment. With regards to profits, we do have to run a profitable business in order to provide the same patients with the treatment that they deserve, which is with the best technology, with the best materials, and obviously in order to do that, it has to be a profitable business. Can ethics and profits coexist? Absolutely. There's no reason why it shouldn't. For any profession, that would be easily manageable, especially if the dental professional is following the ethics and jurisprudence they graduated with.
Dentistry has to be profitable to be ethical, because to be ethical, one wants to offer the highest quality of care that's possible to the patients. And if it's underfunded, one just can't do that. So one has to really keep one eye on the financial support to the dental practice. We don't get any support from anybody else except from the patients. And so we depend on that. If our patients do not agree with our ideas of treatment, they'll vote with their feet and they'll walk away. So if they agree, then they'll support the dental office. My dental office is quite successful. I do believe my patients vote with their feet, and they have agreed with my idea of an ethical dental practice. So I hope I'm complying with that, and I'm trying very hard to be the best I can, and I need the money to do it.
That's an interesting question, and I'm going to answer it by saying that not only can it, it has to. Profitability ensures ethics. And the reason I say that is, if you're making a profit, you don't have any temptation to compromise. You don't have any temptation to look at a procedure and go, oh, how can I cut a corner here to save a buck? If you're making a profit, you're not going to send your patient's work out to an offshore lab that might charge 10% of what a licensed Canadian lab might do. You're not going to take an example of, you know, when you make a cap, you take an impression. It's very important that that's extremely accurate. If you're not making a profit and it looks okay, maybe you're just going to send it out. But if you're making a profit, you're going to look at that impression and say, no, this isn't any good. I'm just tossing it. There's no going there at all. You know, you can spend that money on your education, on your team, and that sort of thing. So I would say, yeah, absolutely, you can have an ethical dental practice and a profitable dental practice, and I would much rather go see a profitable dentist than one that was running on the edge or not making a profit, because I know the profitable one is going to give me exactly the best treatment, the best materials, because he has no reason not to.
Isn't that a silly question? Our dental profession here in Canada requires us to uphold the highest standards and ethics in order to run our practices. So ethics and profitability come hand in hand, because without ethics, our doors close. We can't run our practice anymore. So therefore, it's a misplaced notion that if a practice is profitable, it's not ethical.
One of the questions that prompted the most response was this: why is a Canadian patient offered one treatment plan at one dentist and another at a different dentist? We wanted to hear from Canadian dentists why their training and their years of experience may impact the options that they provide to their patient.
Well, I think in a way it's a complex question and it's a simple question. Dentists have different areas of interest and different strengths. And also they pursue different enthusiasms in terms of continuing education and so on. So different dentists look at the same situation and see it with different eyes. So I think that's one thing. And secondly, any problem usually has more than one possible way of approaching it in terms of a solution. From my point of view, I try to, let me stop for a sec. I have an interview with any new clients or patients, and one of the things one of the simple questions I ask them is, would you prefer to have long-lasting solutions that cost more or temporary solutions that cost less? Invariably they say, I would like long-lasting solutions, but they pause and the question mark is quite obvious. They're worried about how much is this long-term solution going to cost. And I simply say, if that's what you're interested in, I'll always present that alternative to you. But if for any reason it's not practical for you to do that at this time, then we'll look at alternate ways of dealing with the problem.
It's a very good question. And number one, any kind of any patient that comes to me, if they have a comprehensive case, I always tell them to go get a second opinion, so that just so they understand what is involved. But I would say that we have many dentists. You know, I think there's 8,000 dentists in Canada, and all of them are trained in different places. We're seeing patients from different walks of life. We're seeing all kinds of different issues, and I think that's. I believe that all dentists are genuinely want to take care of the patient. We are health professionals and we want to take care of you. I'm sure there are dentists, there are some dentists out there that are interested in making a lot of money and everything. You know, dentistry has offered me a wonderful life, but I'm very passionate about what I do. I care about the patient, and I want that patient to be taken care of as best as they can. Now, there's people that go around looking for all kinds of different treatments. There's people who want, I mean, the cosmetic industry wasn't started by the dentist. It was started by the demand for it. We are just filling the demand. We're helping people get to where they want to go. You know, people have been aging for years, but now in this generation, they want to take care of themselves. So if we don't educate ourselves for that, how can we deliver a proper service? So when you go to different people and you can get different quotes and different suggestions based on experience, suggestions based on clinical experience, and how many years they've actually practiced. I've been practicing for 30 years. So when I tell somebody that a tooth is going to fail over their lifetime, I know that because I've been there. I've seen teeth fail because of a certain circumstance like that. But we've also seen over time how gum disease has ravaged people's mouths and they've lost all their teeth. So again, it's the comprehensive care where we're looking at the whole person, and we also are trying to predict something that is a little bit unpredictable. But experience gives us a little bit of a window into what may happen.
Well, I mean, dentistry is as much as an art as it is a science. And there are quite literally several different treatments that might be acceptable depending on the patient's overall health, depending on their finances, depending on any number of things. For example, a patient who's missing a tooth could have a fixed bridge, which stays in place. They could have an implant, which replaces the tooth by putting a screw into the bone. They could have a partial denture, or they may elect to do nothing and just live with a missing tooth. All of those are, to some degree, a viable choice for the patient, but they all have different costs, ranging from obviously zero if there's nothing replacing it, up to, you know, probably the more expensive would be the implant. And the other issue is that dentists are differently trained. They have a different focus. Some dentists may feel that, oh, we don't want to put a filling in this tooth until it's very large or until it breaks, whereas other dentists may say it's better to put a smaller filling in now. It's less expensive than having to treat something more advanced later. And we still live in an area where, in a country where I can decide that I want to spend my profit out of my clinic on continuing education, on equipment. So that has the cost. I may charge more for something because I'm more experienced at it. Someone else may charge more for something else because they're more experienced at that.
Patients often ask their dentist, how is my oral health connected to my overall health? We also ask this question of Canadian dentists.
Well, from the patients I've seen and from studies and numerous studies done in different fields of dentistry, you know, the mouth is a portal to the rest of the body. Gum disease has been linked to diabetes, cardiovascular disease, and just from the patients I see, the patients that have the cleaner mouths have a better overall physical health. You know, the mouth is the dirtiest part of the body, and if it's not maintained, there's likely other parts of the body that aren't maintained either. So if you address your oral health, you're sort of in tune and value other aspects of your health as well.
One of the most common infections afflicting Canadians is gum and jawbone disease, often called gum disease, which doesn't say enough. It's the loss of bone and so on that means that people lose teeth. But it's still a chronic infection, and so it is a drain on our health. And it's very well established now that people with chronic infections have an increased incidence of cardiovascular disease, diabetes, and now they're talking about Alzheimer's, and so on. Life is challenging for all of us, and there's so many things that we can't control, especially in the area of our health. This is one thing we can control. If people take care of themselves on a daily basis in an effective way, they don't have chronic infections, and they don't have to generate problems that are costly to solve. So this is a choice people have. They can have this health problem or not. And I am surprised at the number of people who don't respond to information that can make them healthier.
The mouth is sort of a window to the rest of your body. We can actually see things going on in the mouth, issues that you might have physically, systemically. And you can see the, sort of how exposures in the mouth and how those are connected. So dentists can be the first line of defense. We are actually seeing people more on a regular basis than doctors, than any other of the health professionals. So by being able to come regularly to your dentist, we're not only cleaning your teeth and checking for cavities, but we're looking for your overall general health. And if we see something that's an issue, we bring it up. We're trained like that. We have a medical background. There's a reason for our medical background. It's not just because they think that we need to know these kind of things and we're never going to use them. It's important that a dentist, not only are we clinically capable to do fillings and to do cleanings and to do crowns and veneers and all that stuff, but we're also able to understand what's going on in your mouth and how it correlates to your body. It's very important to you or to the general public that we're looking after them.
It's extremely important. The mouth is a gateway to all sorts of areas of overall body health. Because you see a dentist more frequently than your physician for the most part, they can see things, and you're looking deep into your mouth, they can see things that the average physician really wouldn't, or you wouldn't be able to see yourself. If you have a sore on your arm, you can see it, I've got something going on here, I'm going to go see the doctor. But very few people actually, will look in their mouth and say, oh, there's something going wrong there. So it's really important. One of the scariest things is that oral cancer kills more women every year than cervical cancer, as well as men. If it's caught early, the survival rates are very good. If it's caught late, it's very poor. And we as dentists have an obligation to understand that and to look, and that's just the most serious. We can see diabetes before you may be aware of it. There's all sorts of other things going on that we can see in the mouth that relate to overall body wellness. So it's extremely closely related.
Another question was this: can Canadian dentists do better to serve their patients? We wanted to know if they think they could do better.
The best thing a Canadian dentist can do is to educate the patients. A patient comes in, they usually come just to get a general checkup, or they come to address a certain issue. When we look in their mouths, we may find something different. We might recommend a certain treatment that they weren't ready for. But in order to bridge the gap, I try to get what the dentist wants to do or needs to do, and what the patient wants to get done or needs to get done on the same level. I find it's much easier to treat a patient who values the treatment that's being offered to them, and that can only happen through education.
the best thing dentists can do is actually connect to their patients, form a relationship with their patients, and this is what I try and base my work on. If we there'll be more trust between patient and dentist. There will be more better quality of work if only the relationship actually gets better, and that needs time to do that.
The best thing for any dentist to do is to spend time educating their patient as to what their options are when it comes to their oral health, why oral health is important to them, and not rush patients into decisions, but let them understand why the dentistry is important, what their choices are, and let them make the decisions. That's the best thing you can do, because an informed patient, or an informed consumer, if you will, is the best consumer. When a patient knows what they need and knows why they need it, they can make a good, solid decision.
I think we are on our way to serve the patient, the Canadian patient, better. I think through educating ourselves, through providing options for our patients, providing them great dental care, to be interested in the health, the overall health of our patients, to take care of them, to instruct them, to teach ourselves, to teach our staff, to make it, we are forming relationships with patients on a daily basis. I love what I do. I've spent 30 years doing it, and today I love it just as much and even more than I did when I first started. I have a relationship with my patients. I care about them. I care that they are healthy. I care that they take care of themselves. I care that they know about everything that I know about. That if something new comes out, I want to share that with them. If something isn't good, I want them to know that too. So I think the model is on its way. Are we there yet? I don't think so, but we are definitely on its way. We are definitely on the way to making sure that the Canadian public has the best care that they can possibly have. I am committed to that, and I know a lot of other dentists are committed to that. We care about you, the patient.
In every dental office today, the dentists and their whole team are continuously educating their patients to have a healthier oral health. The hygienists are always telling them how to do better, to maintain their mouth better. The dentists are always giving the patients many treatment options and trying to restore their teeth in better ways with better materials. So I think they should just hold the course. They're doing so darn good. In fact, many of the other professions are copying dentistry's model with doing preventative care. I mean, why do you think today that we're getting cholesterol-lowering drugs, blood pressure-lowering drugs, all these things? This is all dentistry and its preventive direction.
Listen, I think what dentists need to do is to listen. If we stop and let the patient speak, it's amazing what you learn. Patients often don't feel comfortable, nor are they given the opportunity to actually speak. Explain it is to the dentist exactly what it is that they're looking for. I think we may be a little guilty of speaking a lot. We have a lot to say, a lot to teach, and I do it all the time. But to engage the patient, to make the patient feel comfortable, is to create that open dialogue, to create that communication. And so I like to sit back, similar to the way I'm sitting back right now, and say absolutely nothing, and let the patient talk. Then we're on equal footings.
So the final question remains, what's in store for the future? Canadian dentists will continue to be at the forefront of innovation, and Canadian patients can expect the best quality of care in the world.